Okay, there we go. Okay, so this person's on the ground. The first thing I'm going to do is stop, right? I'm going to look for fire, wire, gas, glass, traffic. I'm looking for hazards to myself. Are you okay? He says nothing. Okay. My name is Virginia. I know first aid. Can I help you? He still says nothing. Okay, so I have that implied consent. Open your eyes. Open your eyes. Says nothing, not responsive to voice. Okay, let's see if he's responsive to pain. Okay, do it firmly enough so they can feel it. Not responsive. Okay, so he's truly unresponsive. So next I'm going to check for breathing for 5 to 10 seconds. Tilt the head back and check for breathing for 5 to 10 seconds, watching the chest rise and fall. And breathing is present. Okay, let go. Okay, now I'm going to call 911. So you in the white sweater, I need you to go call 911. I have an unresponsive person who is breathing. Do you understand?
Yes.
Okay, once you call 911 EMS, I need you to bring back the AED. Okay, good, thank you. Let me know when you've done that. Okay.
Okay.
So breathing is good. No need to do CPR. So circulation, airway breathing, we're gonna skip that. We're gonna move on to severe bleeding. So luckily I have some gloves and I'm going to check for bleeding. So I'm gonna slide my hands underneath the head, look at my hands, okay, look at the face for any reaction, okay, under the neck, look at my hands for any blood, look at the face, okay, under the ribs, look at the hands, face, small of the back, hands, face, skip the hip. Okay, the hip has too many blood vessels. If there was an injury to the hip, we don't want to aggravate that and cause damage. Okay, each leg individually, looking at my hands. Okay, and then each arm individually. Look at my hands. Okay, no reaction to the face. All right, no severe bleeding. So I'm going to treat for shock. Okay, likely he's in shock. Breathing is good, so I don't have to do CPR. What position could I place the person in, maybe, in case they vomit?
Recovery.
Recovery position, right? So I can do that. So to do recovery position, I'm going to place the arm that's close to me, and they're quite floppy because they're unconscious. Okay, that arm goes above the head. Okay, this arm is tricky because when they're unconscious, they have no control of it. So if you put it there and let go, it's just going to fly back down. Right? It's not going to hold itself there. So you have to support the head on the same side you are on. Okay, grab a hold of the leg, use that as leverage while supporting the head, keeping the line of the spine intact. Roll them towards yourself. There we go, all the way over. Okay, so the elbow's on the ground, leg comes out like a little kickstand. You can check the back for bleeding as well. All right, get them a blanket. Okay, give me your sweater. Okay, and I'm going to talk to them. Everything is going to be okay. Okay, what can I move on to next? Just mentioned it, the secondary assessment, right? The sample questions. So obviously I can't ask him, signs and allergies, but if there's someone that knows him in the area, they might know the medical history, they might know a little bit more details, okay? Otherwise, we're just waiting for EMS. We're monitoring the breathing, we're monitoring ABCs, making sure the airway's still open, breathing is good, and there's no bleeding that pops up. Okay, thank you. All right.